Well, today we saw the Minister of Health, Dr. Zweli Mkhize, joined by the Minister of Mineral Resources and Energy, Gwede Mantashe, here at the Job Shimankani Tabani Hospital here in Rustenburg in the Bojanala district. You would know, of course, that the Bojanala district in the northwest has the highest number of COVID cases. It's about 77% of the cases, being 27 of the 35 cases of COVID-19 in the province. But to get more details about what the Minister, Zweli Mkhize, was saying this morning, he's joining us now to give more details. Minister, thank you very much for your time. You were addressing the media this morning, but also just tell us, what is your concern with the rate at which the cases are increasing and also people are dying?
Well, we are seeing the numbers of cases increasing. It will increase.
Okay. Sorry to interrupt you shortly, the Minister. Let me just maintain some social distance. Perhaps if you can take your mask off, as we're just trying to hear you clearly. We're struggling. Okay, there we have it. Thank you so much. You may continue, Minister.
Okay. Well, we are concerned with the numbers that are increasing, but we are concerned with an understanding that they will increase anyway. The objective of our involvement in the campaign, the containment campaign, is to reduce the rate of increase, which means that we must not have the increase so high as overwhelm our health services. So as I move around, we're looking at the level of readiness. We gained a bit of time with the lockdown because it changed the trajectory. So the rate at which the infection is increasing is slowed down a little bit than what it would have been before. But secondly, we now already have time to put up field beds so that when the numbers increase, we've got more spaces to be able to look after those patients. So when we looked at Gauteng, Western Cape, Eastern Cape and KwaZulu-Natal, they've already moved ahead to put those field beds, which means when the numbers increase, we'll be able to contain them. So from that point of view, I think there's a bit of progress that we are quite comfortable about.
Yeah. The Minister, also there was something interesting that you mentioned this morning along the lines of, as a country, we've learned from China that at hospitals, patients that have respiratory problems should be separated from those who don't. Can you just elaborate on that?
Yes, what we have now said the hospitals must do is to start getting what we call a triage, which is a separation point. So anyone who might be having symptoms, would like them to start putting them aside so that they could be separated from where the general other patients are. Then they can then look after those who have got symptoms, which might suggest that they could have been infected with COVID-19. If we do that, that means we will actually reduce the mixing of people. So that work is now being undertaken. Secondly, we have also said that the people who might be having an infection may be admitted in a ward, but they may not be so sick as to stay in hospital. So we need to move them out to beds which are called field hospital beds, where they can be treated without having to spend too much time in the hospital, because they can't go home. They must still infect their relatives if they go home. So we have to keep them there. So people will be kept even if they are not feeling so sick as to stay in the hospital, simply to protect others from getting infection. Yeah. So those are some of the containment measures that we are now emphasizing.
Yeah. Minister, sorry, I know you have to go, but just two more questions. So we understand, Minister, there's a lot of people on the ground that have this belief that come cold seasons like winter, the rates will go even higher. Can you just elaborate on this, maybe as to, is that the case or not?
Well, there are two issues about winter. One of them is the fact that people might tend to cuddle closer because it's cold, and so the infection level may be even higher because it's a bit difficult to do distancing. But the second problem is that the symptoms of a normal flu are not different from the COVID-19 flu symptoms. So you will therefore have a difficulty determining which is which. So the numbers will go up and therefore we need to test more. We need to actually isolate more people. We need to actually quarantine more people whilst we are trying to figure out which of the infections they've got. So that is likely to happen, and that for us is one of the issues, which is why we thought that it's important to talk about getting ready so that when that time comes, we've got more space to admit people in the hospital. With that, we will admit people more. It must be understood. It will happen.
Thank you very much for your time, Minister. There, the Minister of Health, Dr. Zweli Mkhize, bringing us up to speed about what came up during the media briefing this morning. Also, we had the Minister of Mineral Resources and Energy, Gwede Mantashe, pardon me. And in short, he also just mentioned very important issues as well. One being that mining companies should not prioritize production over ensuring that the workers are safe. The second issue there that he mentioned was that there is a lot of precautionary measures that the mining companies are taking and adhering to in terms of the regulations, but he said testing is not done enough in the mining industry. Studio?
Thanks very much for that report. My colleague there, Sellwane Khakahu, just speaking to the Minister of Health there.